This webinar. I'm Eric Hobbs, CEO of Technology Associates, and while I'm usually acting as the moderator for this series, today I'm going to be your presenter as well. So before we get into our presentation on HIPAA security, I'd like to get some quick housekeeping details out of the way. If you have any questions for me during the webinar, just type them into your GoToWebinar panel, and I will either answer them right away, or I may save a few up for the end. We have a few minutes for questions. And it seems appropriate, given the subject matter, to point out that your questions are going to be anonymous. So I will get into that. Also, bear with me. I normally moderate versus present, so I'm doing both at the same time. So I got a screen full of screens here to pay attention to. So bear with me on that. Also, I want to make you aware that since our webinar was delayed, we've got another one coming up really quickly. It is going to be Thursday, June the 18th. And it's going to be with Scott Hensley. He's a partner at Stansel & Company, and he's going to do a webinar on individual and business tax planning. So without further ado, let's get started. So first, we're going to avoid a lot of typical fluff. I'm assuming if you're on the webinar, you kind of have a basic understanding of HIPAA regulations and where you are, so we're going to get right to the meat of it. Who needs to pay attention? First, covered entities. And I know there's been a lot of discussion about what is a covered entity and what isn't. I think I found a pretty good resource, at least according to DHHS, a nifty little organizational chart that they have provided to help you understand if you're a covered entity. Now, this just covers persons, businesses, and agencies. It does not cover the other covered entities like healthcare provider, health insurance companies, and those type of entities. But I'll show you a link in just a second here. Actually, right now, there it is. You can go there if you want to look at those other entities. So, what is a covered entity? One, does the person, business, or agency furnish, bill, or receive payment for health care in the normal course of business? If they do, they may be covered. If they don't, they're not covered right out of the gate. So if that is a yes, does the person or business send any covered transactions electronically? If no, then not a covered entity. If yes, then yes, they are covered. So it's as simple as those two questions. So who else needs to pay attention? Business associates. And we got caught up in a lot of this just based on kind of what we do in our business here, being a business associate. And I've seen a lot of other businesses that are involved with medical practices that just right out of the gate, bang, here's sign our BAA. And a lot of times they're really not business associates. So who is that? It's a person who performs a function or activity on behalf of or provides services to a covered entity that involves individual identifiable health information, who is not a workforce member. In other words, doesn't work for the covered entity. Also understand, another covered entity can also be a business associate. So don't, just because you're working with another covered entity or one that you assume is, you still have to have a business associate agreement in place for them. So the key here is the business associates function involved PHI. So for example, your office cleaning service, it really isn't a business associate because what you hired them to do doesn't involve PHI, unless of course it does. So take the other side of that. Say for instance, they're supposed to take out the trash or dump the bins in the administrative office. They may be. Of course, you could kind of, if you're doing your due diligence on the front side and you're removing or destroying the PHA properly, then you don't have to worry about somebody like an office cleaning service being a business associate. I hope that makes sense. So with that in mind, word to the wise, don't fall for the marketing hype. HIPAA and high tech or in the ACA is part of this also, are some pretty complex pieces of legislation, and as part of that, every Tom, Dick, and Harry is jumping on the bandwagon to have a certified this and a certified that, and then charging people out, businesses for certifying them. understand that the Department of the HHS and OCR, which we'll get into who they are in just a second, don't endorse any private consultants or educational providers, seminars, materials, or systems, and do not certify any person or products as quote-unquote HIPAA compliant. So the privacy rule does not require attendance at any seminars, and all of OCR's materials are available free on this website. And actually, I'll give you the website in just a second. So understand, if you're trying to be sold something that's quote-unquote HIPAA compliant, it's not. All right, it's your responsibility to be HIPAA compliant, and that includes me and this presentation. Here's the source down here, so you can go and find out more about that. So next, the wall of shame. First question: what are the privacy requirements designed to do? Well, they're designed to prevent the exposure of personally identifiable healthcare information, i.e. my patient chart. One of the things that DHHS does is they maintain this wall of shame. So any of the breaches that they are notified of, they immediately put the company up online so you can look at all this. So really, how is the data getting out? I downloaded all the data from the wall of shame for 2014 and broke it down based on kind of how this data was getting out. And something stood out at me that I was kind of shocked. I was expecting hacking and IT incidents to be the majority, but as it turns out, theft is by far and away the largest category, the largest reason for a breach. Second is unauthorized access, and then hacking and IT brings up in third place. So if you really look at this, theft and unauthorized access is 80% of the breaches that are out there. So if anything, focus on those two areas, and throughout the presentation as we go through this, I'll show you kind of how you can focus on those things and really give them the attention that they deserve. Also, just to clarify, when we talk about unauthorized access, we're talking about unauthorized access outside of the scope of hacking and IT. So I may, break into a server system and have quote-unquote unauthorized access. That would be under hacking and IT, where if I was sitting, at walking through a doctor's office and saw a patient chart, that would be unauthorized access. So just want to make that differentiation there. So you can go see this information if you want and play around with it. It's at ocrportal.hhs.gov. It should be fairly easy to find if you just Google wall of shame. So, security facets of HIPAA compliance. There are several facets to an all-encompassing security plan. The regulations break them down into administrative, physical, and technical components. And when you see checklists, you'll notice that there is a lot of overlap, a fair amount of duplication, and some really illogical grouping across these facets. In addition to those three categories, we also use privacy rules and organizational requirements as kind of bookends to address some of the other compliance issues, record-keeping issues of HIPAA on either side of those main three categories. So let's dive into it. Privacy rules first, administrative safeguards, physical safeguards, technical safeguards, organizational requirements. We'll dive into those and run through them real quick. So privacy rules. Pretty much everybody does a good job on this component. It's the easiest to implement, and for most entities, this is where they started, and unfortunately for some, it's also where they stopped. So this piece covers things like posting your notice of privacy practice clearly and prominently, providing information about patients' rights, contacts for privacy concerns, making your staff aware of the forms and how to address patient questions and concerns, completing forms for clients to acknowledge the MPP. So all this is pretty straightforward stuff. So yeah, while this is good and this required first step, it really doesn't do a whole lot, at least in my mind, to protect PHI. It's required, but doesn't help you any. So to me, it's check, 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 next. I think every covered entity I've ever been into seems to do a pretty good job of these type of things. So administrative safeguards. Here's where we start to get into the meat of compliance. So security management is the first piece of this, and it's mostly focused on risk analysis and risk management, things like doing a risk assessment, device inventory, software inventory, a user and a staff list, policy and procedures documented, etc. I kind of lump all this stuff into getting your ducks in order. So next we move on to more managing risks around network monitoring, updating the device inventory, restrictions on software installs, defining wireless protocols and filtering, firewall setups, network maps, and then on into penetration testing and doing vulnerability scans. And at this point, we're moving into more technical realm where you really need to have someone who's trained in your technology to give you some guidance and assurance on these issues. A lot of this stuff, the second half, the security management checklist, is really technically oriented, and you need some help there. So workforce security includes items like having employees sign confidentiality agreements, doing employee reference background checks prior to hiring, proper employee termination policies, and disabling user accounts. All pretty common sense items, and there really shouldn't be any surprises in this part of the checklist. Access security is really about ensuring that any third-party clearinghouses have properly executed business associate agreements. This can be a little tricky. Access to PHI from third parties is documented. In other words, you need to document who has access to what and why. And access from internal staff is also documented and reviewed. So what do your internal people have access to and why? And this item is more awareness than really any technical challenges that may be out there. Security awareness comes from the chunk of the code is 164.308A5 A and B, if you're wondering. And on my checklist that I'm going to give you as part of this, I have the regulation numbers listed out there. But this is sort of a hodgepodge of training and implementing security systems rather. So this is one of those areas where the code is a little disjoined from the logical implementation. For example, this area includes staff training on security as well as installing malicious software protection like antivirus, anti-spam, preventing auto runs, doing a security scanning tool, as well as monitoring system logs, limiting administrative access, and password policies. And this is a good example of the kind of illogical grouping that I was talking about. And in version 2 of our checklist, we're probably going to change the order a little bit to group these questions in a more logical form, because what we're finding is we're going through it. It's easier to hit all the technical pieces like contingency is focused on your backup and disaster recovery and business continuity planning. And then evaluation covers the need to not set it and forget it, but rather adopt a periodic review policy to review and update your security policies and procedures from time to time. The recommendation is annually. I'd recommend you do it a little differently, a little more frequently, but on selected components. So, for instance, 1 month you may do security management components and workforce items. And then the next month you may do incidents and contingencies. So it gives you the ability to kind of take bite-sized pieces of this versus doing it once a year where you've got weeks of work. You can split it up and just do a couple of days a month and get through it and keep things updated. So, and of course the business associates, pretty straightforward, pretty plain Jane, making sure all your business associates have a properly executed BAA and that they understand their legal responsibility around this. Physical safeguards. This kind of continues the compliance items, focus more on physical access to PHI. Example, you're holding it in your hands. So facilities covers physical security and includes an office security plan to cover locking doors and windows, sign-in and sign-out sheets, ensuring that changes in repair to the physical building don't unknowingly compromise your security stance. Pretty straightforward stuff. Workstation security covers things like privacy screens, locking down USB, CD, and DVD writers so people can't, just click and drag PHI on workstations off to a portable device. Some requirements around password complexity, and you may notice that's a duplication. We mentioned that before, but like I said, a lot of these the steps in this are kind of duplicative when you read through the legislation. And workstations locking after a period of inactivity, very, very important piece of that. Devices and media covers your disposal procedures, rather, for physical and electronic media. And you would think that most everybody would have a really good handle on these items, because it seems like you need to do these things regardless of whether or not you're under any type of covered entity privacy concerns. But really, this is where the majority of the data leak comes from. In the theft and the unauthorized access, leading the pack rather. So clearly, more emphasis needs to be placed on physical safeguards versus a technical solution. So technical safeguards, we're jumping into, as you can probably guess, gets into the more technical aspects of system security. And most of these items on the checklist, you're really going to have to rely on your technology department or technology partner to ensure that they're done properly. You'll have very little ability, unless you've got some technical training behind you, to really prove that these items are being done. Some of them you can touch and feel, most of them you can't. So ensure that you really have a level of confidence and trust in your IT provider. Have some basic documentation from them as to the status of these items, and make sure you have a properly executed business associate agreement with them. So access controls focuses on using unique logins. No more station 1, station 2 logins that everybody knows the password to. You can't do that. Password strength and complexity, as well as automatic log-offs. Again, we're mentioning that again. It comes up again and again in the legislation, more duplication. So this also covers data encryption, activity tracking, who does what and when, and the logging of remote activity. So if anybody remotes into your system, that needs to be noted. And I've highlighted encryption, and I'll go through that a little later, but suffice it to say, encrypt your stuff, because then that mitigates the issues around exposing PHI due to theft. Integrity, it's a little fuzzy as I read it, and it repeats a lot of what's covered in the access controls above, but basically they want you to be able to know who changed what and when. This is really more a function of your EMR to be able to do that. But obviously needs to be there. Authentication is another area of duplication. Basically, are you following best practices around logins with unique user IDs and proper passwords? And then transmission security, part of the checklist. This can be a tough one. It covers encrypting data before transmission, which that's really going to require cooperation from all of your business partners and in some cases patients. So this area also recommends running desktop-based firewalls, which can be a total nightmare to get working properly, especially if you're running multiple network applications. And it throws in a requirement to monitor changes to workstation setups. And if you've got a partner that's using a good network management tool, they should be able to tell you that if anything changes hardware-wise or software-wise on workstations. So you should be able to meet that that piece pretty easily. So as far as transmissions, one of the things we see a lot, people forget their backups. Yeah, everything's encrypted, and you pull out their USB drive and take a look at their backup, and it's not encrypted. And if it's not encrypted there, it's probably not encrypted during transmission. So most good backup software allows you to encrypt during the backup process. So then if you lose the device, or it gets stolen, or you transmit the data somewhere, it's automatically encrypted. So organizational requirements, it wraps it all up with really ensuring that policies are all documented, reviewed, and updated regularly, as well as being kept for historical references for, believe it or not, 6 years is when they want you to keep this information for. So the top 5, let's go through them. This is what we see. This is really where you need to be focused on. It is, well, I guess the question is it possible for a small business to be 100% compliant all the time? I'll tell you, probably not. You know, unless you got an army of people running around checking these things, at any point in time, you're probably not compliant. So it really behooves you to start with the big risks and certify them a little more frequently. And after all, really, the purpose here is to prevent unauthorized access. So if you can do that, and maybe you don't maintain your records for 6 years, I think you're probably going to get a pass on that, all things being considered. So remember, theft and unauthorized access, start here. It's 80% of your risk. So this is logically where we would start, and you need to start with data encryption. So servers, desktops, laptops, backups, again, capitalize, don't forget them. Mobile, if you're accessing PHI on your mobile device, or you're using CD-ROMs or removable media, USB sticks, any of that stuff, you've got to have the data encrypted. And looking at the detail behind the data again and again, that shows exactly where the majority of these issues are coming from. Let's see here. Next, logins, lockouts, complexity, and expirations. So lockouts are something that we don't see people implement. It's very easy to do. Set it up in such a way that, hey, if a user account has 3 or 5 incorrect login attempts, lock it out for 12 hours. And that will help a ton in mitigating risk, especially for some of the accounts that are well known, like administrator. Make sure you've got some complexity in your passwords, and make sure they expire. You don't need the same password for a year. If you do that, you might as well just not have one. And also make sure that your IT folks have set up your systems to track the logins and logouts. In other words, who's logging in, who's logging out to your system. Burn the sticky notes. Don't let people be lazy on this. It just makes getting access to your data super simple. And I'll tell you a quick story. So we're working with a law firm, a client of ours, and they're moving locations. And we went over to do a walkthrough of the new building. As it so happened, I knew the company that was in the building prior. It's just kind of a happy coincidence. And as we're walking around and looking at setup and wiring and preparing to move our current client into the space, we walked in the computer room, and all of their administrative passwords were on a sticky note thumbtacked to the wall. So no reason to have that stuff laying around, and if you're going to move, at least take it with you. So disposal, both electronic and paper. A lot of the unauthorized access is around files, paper files, and film files. So burn it, shred it, drill a hole in it. This should be a fairly easy thing to do, especially nowadays. Lastly, be sure to communicate these requirements to your IT folks and hold them accountable, okay? Be sure that they're taking their responsibility, which, by the way, after signing a BAA, it's a legal responsibility. Make sure they're taking that responsibility seriously, and that you're continuously monitoring and reviewing your systems over and over again. Understand they can't just set it and forget it. They can't tell you, oh yeah, well, we put those systems in, I checked them, they're working fine. I get you. You know, month in, month out, those things need to be reviewed to ensure they're still compliant, still doing what you think they're supposed to be doing. So, myth busting time. A few myths that I have heard. I'm small and I can hide. Yeah, no longer the case. There really isn't an easy way around proper security, and hiding wireless using SSID masking or isolating a network from any internet access are both techniques that I've seen being used with very limited success. I mean, masking SSIDs is a joke nowadays, and regardless, even if you've segmented your systems from the internet, you've got to move files on and off of that, if not just to upgrade applications, which exposes you to risk. And plus, ACA is forcing digital transmission of PHI, so you're not going to be able to do that for long. Another one of my favorites, if you're in the cloud, you can ignore all this. So just be sure your cloud provider is willing to sign a business associate agreement and uphold their legal responsibility. And I say that tongue-in-cheek. Most won't, and that'll tell you something. Microsoft is the only one that I've found who is willing to do that around their Office 365 product. So if you've got your data off in the cloud, it's still your responsibility. You can't just throw up your hands if you have an exposure and say, well, you know, it was on their systems, not mine. It's your information. Windows 2003 and XP are still okay as long as I have good antivirus. Again, probably not the case. Sorry, no. The issue here is around security and patching. And running on an operating system that's 12 years old, probably not a good idea. We don't need encryption because we lock our offices each and every night. Yeah, maybe you do, but also remember, physical security is good, but it can always be overcome. If you encrypt, you won't need to worry about this piece. And remember, as secure as you think your offices are, the majority of PHI is leaked through theft. So what does that tell you? HIPAA compliance is all about computers. Wrong. Most of the compliant pieces are around user practices and preventing bad ones through assessment, training, and verification. So the technical components of HIPAA compliance are actually fairly straightforward and easy as long as they're being routinely updated and checked along the way. It's the training piece. It's the users that cause a lot of the issues. So all that being said, the future of enforcement, and this kind of came as a shock to me as I was brushing up on a little more research on this. Right now, the Office for Civil Rights, the OCR, is appointed itself or been appointed the enforcer of HIPAA compliance. So they see PHI as a violation of someone's civil rights, which, don't get me started on that. But what they claim is by enforcing the privacy and security rules, OCR helps to protect the privacy of your health information held by health insurers and certain healthcare providers and health insurers. So great, all good and well, according to their website. But know this, the OCR has been ramping up their audit process and is now indicating that it will be used as an enforcement tool. So they have started doing audits about 2.5 years ago, I believe. They had KPMG come in and help them how to do audits. A lot of them were field audits. A lot of them were desk audits. They continue to refine that process. They're doing another 300 or 400 this year. And at that point, my guess, and based on what they are saying, they're going to continue to expand that program, and they're going to use it as a proactive tool to walk into your place of business, decide that you're a covered entity, and go through the audit, and at the end of that, write you up. So I can see that coming. So I want you to spend $50, not with me. I want you to spend it with Amazon and get this book, HIPAA, Privacy and Security Compliance, Simplified Practical Guide for Health Providers and Practice Managers, 2014 edition. Robert Brzezinski, I'm not sure if I'm pronouncing that right. This is a great book. This is the book that we've based our HIPAA checklist and compliance practice on, of which, again, you're going to get a copy. So I really encourage you to get that book. So, checklists. We promised you all a copy of our HIPAA checklist. I'll be emailing an Excel spreadsheet containing our checklist to you, all of you, all attendees this afternoon. If you have any questions or need clarification, please let me know. I'm happy to help you with that. Again, take it as your own risk. I think we've done a fairly good job of encapsulating really what needs to be looked at and giving you some good solid information on it. Again, our checklist is based on Brzezinski's book. Order the book now, as the checklist is going to make a lot more sense with the book to help guide you. So our checklist is a yes or a no, answers to questions, and we relate those into specific parts of the legislation. But in his book, he really goes into, okay, if you answered no, this is really, here's a way you can get around that, or here's a way you can mitigate that risk. So while our checklist is the test, his book is the cheat code, the answer guide. Also, there are a lot of other works out there, like the HIPAA Security Rule Toolkit from NIST, National Institute of Security something, I forget what. Here's the location to it. This is a program that you actually download and install. It doesn't automate any of the checks for you. It just automates the checklist rolling through that. I'll tell you, it's much, much, much more detailed than our checklist. I think our checklist has, probably 120, 125 questions in it. The NIST stuff, even the small one, I think it was like 350 questions. So they're really going into detail on that, and I don't know that most people will need that. So that's what I had. Questions, get them typed in. I've got a couple of them here already. So if you do have questions, pop them in there, and I will get through them. So question one, can you give us more detail on what comprises theft? Yeah, I guess the question is really what is being stolen is the question that's being asked there. And yes, I can do that. Let's see here. In theft, and I hope you can see all this. So this is the data as I broke it down from the wall of shame. Of theft, the majority of theft is network server. So walking into your office, picking up your server, and walking out with it. Really, that's all most people need at this point. And then second is laptop with another 8%. So you would think there'd be probably more laptop theft. And there probably are more laptops stolen, but just less records of individuals on them. So obviously you got the server, you get everybody. So that's probably why this is, these percentages are based on the number of individuals affected in the incident. So I hope that makes sense. And then the last one is email laptops at 3% right here. And doing a little digging, this is laptops is, okay, I stole a laptop and there are records on it versus I stole a laptop and got access to the email and there were records there. But between all that, yeah, that's a big chunk of what the theft is all about. So the next question is a breakdown of unauthorized access. So yeah, most of it's right here. So desktop computer, email, laptop, other portable electronic devices, those type of things, 16%. Network server at 3%. Now remember, when I first looked at this, it really didn't make sense in conjunction with the theft, but this is, they're not, they're separating hacking of network servers. Actually, it's located up here under the hacking part of things. Network server, right here. So all the hacking really mostly involves just a server. This is gaining access to a server without stealing it. How you do that, I don't know. I'm assuming walk up to it and download data off of it and then walk away. I'm assuming that's what that piece means. All right, next question. Keep them coming. I'm kind of sorting through these. What encryption software should we use? Great question. The answer is it depends. I would start by using BitLocker. It's a free tool from Microsoft, comes on Windows 7 Ultimate and Enterprise, and it also has a BitLocker to go component, so you can encrypt data if you need to move it to, say, a thumb drive or something. So I would start with that. Pretty easy to implement. And then even if you do face a theft incident, and your data is encrypted, well, you don't have to report that, right? So they're not actually able to get to the data. So also on the encryption piece, I want to stress again, I've said it 3 or 4 times, don't forget your backup drives. Make sure that your backup is being encrypted when it's happening, and if not, at least afterwards, and don't ship that stuff off-site unless it's encrypted either. If you're doing a quick backup of your server and then shipping it off to box.com or something, you got problems. So don't be doing that. All right, any other questions? Excellent. All right, well, listen, I want to tell you all, I appreciate you joining us for our webinar today. And as a reminder, I'll be sending out our checklist. If you have questions on it, please let me know. Thank you.